I can guarantee you that you've heard the word arthritis come up a few times. There are lots of types of arthritis. That brings up more questions. Is my arthritis something that you can treat? My name is Dr. Erik Nelson and I'm a naturopathic doctor here at Nirvana Naturopathic Medicine. For arthritis, the most common one that we treat and we see almost every single day is osteoarthritis. That's a classic one. You wake up in the morning, you got stiff, achy joints, but after you start moving, that stiffness will go away, but the pain lingers. And we have tons of different treatments that we can use depending on the patient sitting in front of me. The most common of which is prolotherapy, and it's really, really effective for degenerative conditions of all type, of which osteoarthritis is the most common. Prolotherapy can be really, really helpful, but it doesn't work in all types of arthritis. Rheumatoid arthritis is an inflammatory condition. It's actually an autoimmune inflammatory arthritis, which can be very, very painful, cause red, warm, swollen joints that kind of come and go. They can flare up and then they can calm down. And over time, rheumatoid arthritis actually causes erosion and destruction of the joints. So for my rheumatoid arthritis patients, we work on a lot of lifestyle-related triggers and to reduce the number and the significance of the flares when they do happen. It's very, very personal to the patient themselves. There are lots of other types of arthritis which are far less common. Infectious types of arthritis, those can kind of come up overnight. They can be from a cut that didn't heal, that got infected, that bacteria or fungus got into your bloodstream, worked its way to a joint, and caused an acute arthritis. And those can actually be a medical emergency. There are lots of other types of infectious arthritis that are way less acute, meaning that they take days to weeks to even months to show symptoms. Some of those you may have heard of, like Lyme's disease, that can cause very, very weird types of arthritis that move from one place to another. So one day it's your elbow, could be the next day it's your knee. And it could flare up, then it gets better on its own, and it might be difficult for you to diagnose. That's why I'm here. There are a lot of other forms of arthritis, including gout. Very common triggers include alcohol consumption and specific types of foods. Regardless of the type that you think you might have, it's really worth it to come in and just have that discussion with me. And we can work out together whether or not you need further testing or if it's something that is really treatable and we can get you on the path to a better quality of life as soon as possible. If what I've talked about in this video is something that resonates with you, you think that it could be helpful for you, schedule your appointment with me today and we will figure out our best way to recovery.